Welcome to our Trauma Talk podcast. Today, we're delving into the intriguing world of trauma care pitfalls. You know, those subtle mistakes that can make a huge difference in patient outcomes.
Absolutely, it's such an important topic. So, what's the first pitfall we should be aware of in initial trauma assessment?
Well, one major pitfall is failing to secure the airway early in critical patients. It's like sometimes clinicians underestimate how quickly an airway can become compromised, especially with facial trauma or swelling.
Right. So they're thinking the patient looks stable, but things can change rapidly?
Exactly. And by the time they realize it's too late to intubate easily.
Yeah,
So the correct approach is to assess the airway immediately and secure it if there's any risk of obstruction.
that makes sense. What about tension pneumothorax? I've heard that's another area where delays can be dangerous.
Oh, definitely. A common pitfall is delayed recognition of tension pneumothorax. Clinicians might miss subtle signs like tracheal deviation or distended neck veins.
So what's the best way to catch it early?
You need a rapid assessment using clinical findings. If you suspect it, perform needle decompression immediately without waiting for imaging. Time
Right.
is critical here.
Got it. Now what about cervical spine stabilization? I've seen cases where it's overlooked.
Yeah, that's another pitfall. Sometimes in the rush, spinal precautions are neglected. The correct way is to always assume a cervical spine injury until it's ruled out. Maintain inline stabilization throughout.
Definitely important. And external hemorrhage control? I've heard that sometimes clinicians focus too much on IV fluids instead.
Exactly. That's a key point. Relying on fluids without addressing the bleeding source is a mistake.
Yeah,
Direct pressure, tourniquets, and hemostatic dressings should be applied immediately.
makes sense. So fully exposing the patient is crucial too, right? To find all injuries?
Absolutely. Failing to fully expose the patient can lead to missed injuries, but we also need to prevent hypothermia by keeping the patient warm with blankets after exposure.
Speaking of hypothermia, can you explain why it's such a big deal in trauma care?
Sure, hypothermia is part of the lethal triad, along with acidosis and coagulopathy. It can worsen bleeding and affect clotting mechanisms.
So maintaining normothermia is essential?
Exactly. Use warming devices and warm IV fluids to keep the patient's temperature stable.
Yeah.
It can significantly impact outcomes.
Let's talk about shock. What's a common pitfall in recognizing shock in trauma patients?
A big one is failing to recognize shock when blood pressure is normal.
Mhm.
Clinicians might miss early signs like tachycardia or altered mental status.
So they should look beyond just blood pressure readings?
Exactly. Assess for other signs like narrow pulse pressure and use lactate levels as an adjunct.
Right.
Early recognition is key to effective resuscitation.
That's really insightful. Now, regarding airway management in facial trauma, what are the challenges there?
Well, airway management can be tricky due to distorted anatomy. Advanced techniques like video laryngoscopy or surgical airways may be necessary.
And nasotracheal intubation should be avoided in certain cases, right?
Yes, especially if a basilar skull fracture is suspected. It could worsen the injury or introduce the tube into the cranial vault.
That's a critical point. What about confirming endotracheal tube placement? Any pitfalls there?
Definitely. A common mistake is neglecting to confirm bilateral breath sounds after intubation.
Right.
You need to ensure the tube isn't in the right main bronchus or misplaced.
So use auscultation and capnography?
Exactly. Those are essential to confirm proper placement.
Yeah,
A chest x-ray can also be helpful if time allows.
great advice. Now, shifting gears a bit, can we discuss the importance of team dynamics in trauma care?
Absolutely. One major pitfall is the failure to assign a team leader. Without clear leadership, coordination suffers and critical decisions may be delayed.
But sometimes too many people try to take charge, right?
Exactly. Which leads to confusion.
Yeah,
It's vital to have one designated leader who oversees the entire process.
I completely agree, but don't you think that in some situations, shared leadership can be beneficial?
Well, collaborative input is important, but ultimately, having a clear leader ensures accountability and efficient decision-making.
Right,
It streamlines the workflow.
that makes sense. Communication is key then?
Absolutely. Effective communication prevents errors. Using structured tools like SPAR can help convey critical information quickly.
Before we wrap up, any final thoughts on avoiding pitfalls in trauma care?
Yes, Continuous reassessment is crucial.
Yeah,
Patients' conditions can change rapidly, so we need to monitor them closely after every intervention.
that's a great point. I think this discussion really highlights how attention to detail and adherence to protocols can make a significant difference.
Exactly. It's all about being vigilant and proactive.
Right.
By understanding these common pitfalls, we can improve patient outcomes and save lives.
Well, this has been an enlightening conversation. Thanks for sharing these insights.
My pleasure. Always happy to discuss ways to enhance trauma care.
Yeah.
Thanks for joining me in this important conversation.